This is the Emergency Medical Minute, sponsored by Mile High Ambulance.
I was working the other day and we had a patient that came in with intractable migraines. It kind of rattled my brain in terms of what I've learned in med school pharmacology regarding like different treatments for migraines. This patient specifically had concomitant cardiovascular disease, and so that poses an issue with the classic treatments for migraines. So do you guys know what the primary classic treatment for migraines is? So migraine cocktail, what does it have? Sure, Toradol, Benadryl. These are all kind of like side medications. They don't actually work on the migraine mechanism though. So the primary one that you think about is triptans. So there are a few neurotransmitters involved in migraine pathophysiology, and that's primarily serotonin, dopamine, and there's also calcitonin, gene-related peptide, and these all work through the trigeminal system, which is just vasculature associated with the trigeminal nerve, and that's what refers the pain to the central pain centers in the brain and the cortex. So that's what creates a sensation of pain in migraines. So we use the triptans, which are serotonin 1D, 1B agonists, to treat migraines. However, in cardiovascular disease, these actually pose a problem because they induce peripheral vasoconstriction, right? So we can't use those. So it got me thinking, in this patient specifically with migraines and cardiovascular disease, do you guys know what a potential treatment is for migraines and cardiovascular disease? You could use ketamine. I mean, yeah, that would be kind of like last line. You could zonk them out, right? And we use Benadryl in the same way, just to kind of zonk them out. There was a study though that looked at Benadryl versus placebo and found that there was actually no difference. They actually had to end it early for futility. So just kind of knocking them out, sure, that works, but does that really do anything for the pain? Not really. So there's a medication called lasmiditan, which is a sort of triptan adjacent medication that works via a similar mechanism. It's actually a serotonin 1F agonist, and it's specifically approved for patients with migraines and concomitant peripheral vascular disease. The other ones are the CGRP antagonists, which are kind of newer medications. I've never seen us use any of these in the ER. So I think those are like newer medications. It's one that I learned about in my pharmacology course. But yeah, primarily the triptans, and then in cardiovascular disease, you just want to be careful with anything that's going to be a peripheral vasoconstrictor. Any questions? Cool. Thanks.
We'd like to thank our sponsor, Health One Continental Division, and Swedish Medical Center for their financial contributions to the EMM. Donations from them and listeners like you make it possible for us to fulfill our mission of producing and spreading free medical education to the masses. If you enjoy our show, please consider making a one-time or recurring donation to help cover our operational costs and keep the EMM awesome. Click on the link in our show notes to make a donation. Thank you for listening.